listening to Planet Vero Radio. I am Cindy Schwartz, and we are talking about medical apparatus today. I've got Danielle Rivera on the phone. She's calling in from Chicago, and she is the director of Modicine Patient Wear. And I've done other segments on Planet Vero Radio talking about patients and how you can, surgery patients, and how things can be changed to make it more modesty, more friendly, more, what's the word I should use, more approachable, because it seems like surgery is this black hole that someone doesn't really even know much about, that the operating room is, we're all kind of afraid of it. And there are literally 232 million surgeries performed worldwide. And that's a lot of surgeries. That's a lot of surgery patients that could use this information. So Danielle, thank you so much for calling in and for giving us information about Modicine Patient Wear.
Well, thank you, Cindy, for having me. Appreciate it.
And so, Danielle, we want to talk about, Modicine is a great word. It sounds like medicine, and I'm thinking that's why someone did it, named it that way. So it's modesty clothing for the medicine of people.
Correct.
Okay. So what exactly is Modicine, and who started it, and who came up with the idea?
Modicine Patient Wear is a high-quality surgical undergarment that was designed for patient comfort and dignity in the operating room. And I'd like to first give a brief overview of what goes on in the operating room to shed some light on the numerous times a patient is naked and or exposed. And unfortunately, most discover day of that surgeons, residents, nurses, assistants, techs, aides, several dozen people are present in the operating room, all the while the patient is exposed on the operating table. So as a result of this, Modicine was developed by Dr. Scott Trent-Hale, who is an orthopedic surgeon and partner at Ortho, Illinois.
Okay.
And inspired by his colleague, Jamie Phelps, who is an athletic trainer. She herself had seen patients exposed in the operating room. And Jamie was due for surgery and feared the possibility of being exposed from the waist up by her boss, coworkers, surgical reps coming in and out of the operating room. Mm-hmm. So Jamie utilized an elastic bandage to drape herself to minimize exposure. They were able to drape her during the surgery successfully, and from this idea, the concept of Modicine was born. So essentially what started as an elastic bandage evolved into this surgical-grade garment. And from there, Dr. Trent-Hale, who is our clinical advisor for Modicine, took action and designed a garment that would allow patients to feel safe and their dignity intact in the operating room.
So she started out basically with an ace bandage that she wrapped around her breasts to cover them so that she could have some dignity.
Yes.
Okay. And then that morphed into an actual sterile product that can be used in every surgery, every operating room.
Correct. Now, when we say sterile, it is treated with an antimicrobial spray. So what that means is that viruses, bacteria cannot live on the garment itself. It's a big scientific process, but essentially it's just an ion reaction where a positive ion meets a negative ion and the bacteria itself dies on contact.
Okay, so that's a big thing because surgeons, doctors will argue, I have to have my patient in the most sterile atmosphere that I possibly can get, and rightfully so. I mean, I'm not a doctor. I know that would what I want to have in surgery, but I also know I would want to have some dignity and some humility and have some modesty in surgery too. I mean, not everyone has to be totally naked for every surgery that's performed.
Correct, and that's what we at Modicine Patient Wear are trying to advocate for the patient population.
Okay. And so are surgeons allowing the Modicine wear to be present in surgeries, do you find?
We do have orthopedic surgeons utilizing the undergarments. However, doctor approval is required. So we are informing and educating patients inquiring about Modicine that the garment does require approval prior to surgery. It's likely that the doctor may or may not allow the patient to wear the surgical garment without preempt approval. So we really like to advocate for the patient by contacting the surgeon ahead of time, providing them with the information related to the surgical garments and the antimicrobial properties.
Okay,
so the patient isn't carrying that torch by themselves.
Correct. Because you have a lot of burden the person does, the patient does when you first hear surgery. I would be scared to death.
Correct.
Yeah. And so the patient modesty wear available, we're talking about a tube type bra for the females, but you also have underpants available for both men and women, correct?
That is correct.
And so those garments are also sterile per se.
Correct. They are treated with the antimicrobial spray as well.
And so those also would be something that the patient would have to talk with their doctor about if it would be allowed in the surgery.
Correct.
Okay. And how cost prohibitive are these garments? Do insurances pay for them?
Currently, insurance is not covering the modesty garments. They're not considered medically necessary, but the patient can purchase the modesty bra, which is available in 3 sizes for $25, or the modesty brief, which is available in 2 sizes for $20.
And that...
So really, it is an option. We're trying to advocate the choice for a woman or man to have minimal exposure during their operating procedure.
Well, I have to say, just for, ding, 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 $20 and $25 to ensure your modesty, to ensure your dignity that keeps intact. And yes, for listeners out there, it is a big thing. If you've never experienced a surgery, I'm here to tell you that it's a very scary realm. I know that doctors, and kudos to doctors, nurses, technicians that can perform those operations, work in that atmosphere. We wouldn't be able to be alive without you, literally and figuratively. But patients are not used to that arena, and to have peace of mind that you're not going to be totally naked, that you're going to be okay, is just a big hurdle to get over, I think, for the patient. And for just a little bit of money, $20 and $25, to me, that's a no-brainer.
It is. We as the clinician are so desensitized to the patient being exposed, but that's not always the case for the patient experience. Many of them, like I said, arrive to surgery day of, check in, and aren't even aware of the traffic in and out of the operating room while they're exposed.
And there are, like you mentioned in the beginning of the show, there are a lot of people that are in there. And the people are needed. There's a lot of charting. You want to make sure everything's sterile. You want to make sure all the supplies are there. You want to make sure you have all the people hands-on that are needed to do the surgery. So certainly the people should be in there. But it is a wake-up call for the patient when you have no idea that this is going to go on. And I think most often the patients really aren't educated to that point.
I think it's fair to say that that's a true statement, that they aren't provided this information until they arrive. Until
the patient is actually in the OR a lot of times, maybe pre-op. I think there are some doctors that do have videos that kind of show, maybe on YouTube or something, that kind of show like a facsimile of what the surgery is going to be like. But really, you don't really know until it's hands-on and you're actually in the 55, 60-degree room and, you have a tiny thin sheet over you, your gown has been taken off, and you don't have any clue. So, Danielle, we have like 45 seconds or so left. Give your contact information. People are interested in this, and so they can purchase this.
Absolutely. So anyone can visit us on our website at www.modicine.com. That's MODICINE. Or they can contact us by email at customerservice@modicine.com, or contact one of our patient care coordinators at 312-579-4032.
And again, that is Modicine Patient Wear. And also go to medicalpatientmodesty.org for more information. Danielle, thank you so much.
Thank you, Cindy.